Our next guest, Dr. Joseph Marquez, urologist for the Polyclinic. We're talking about men's health prostate awareness.
Dr. Marquez, welcome to Health Talk.
Good morning. How are you?
I'm doing great. Hey, you're a urologist. Tell our listeners about your practice, your training. Give us the day in the life. I always like to do that, the day in the life of Dr. Marquez. How's that sound?
Oh, that's awesome. Yeah. I mean, I didn't even know what a urologist was going into med school. We're surgeons and we're clinicians, and we specialize in the genitourinary tract. So if there's a problem with the kidneys, bladder, prostate, the genitals, especially if it's a surgical problem, that's something we deal with. But we also deal with medical issues like infections and things like that.
I think the common listener would say urology. I mean, that's a male thing, but it's also, male and female patients. You see them all?
Oh, yeah, definitely. So kidney stones happen in men and women equally, infections, bladder cancers. So, sure.
We're in November here, and November is Men's Health Awareness Month. I mean, No Shave November. I'm going to participate. I'm a little gray right now, but that's okay. But let's talk about the prostate. Big deal for men. Tell our listeners, let's do some anatomy and physiology. Why do we have a prostate? And what is it? And why does it become a problem? All that neat stuff.
Yeah, why do we have it? That's a great question.
Yeah,
I don't think anyone has an answer, but... Well, it's a reproductive organ, so it supports basically fertility. That's its only function. You don't need to have it for any other reason. So it creates the fluid that's needed to support the sperm in fertility.
But it can become problematic. And tell us about that. Who gets it, and what is prostate cancer, and signs and symptoms, and we're going to talk about some treatment.
Yeah, so it's a gland. Any gland makes secretions, and that's what primarily its function is. It's where it's located that often causes the problems that we see. So it's located between the bladder and the urethra in the male, of course. So if it gets enlarged, it can obstruct the urinary flow. It can make it difficult to pee. If it has inflammation, you can have blood in the urine. If it gets infected, it can be painful. And then lastly is it can develop cancers. And in fact, prostate cancer is one of the most common cancers to affect men.
Let's visualize this. I know on the radio, but let's let our listeners really understand. So the prostate, it doesn't surround the urethra. It just sits close to it. Or does it engulf the urethra? The urethra is the tube that goes from your bladder that allows you to pee.
That's right. And that goes right through the prostate. And in fact, we'll call that the prostatic urethra.
Okay.
So the prostate's almost like a donut shape with the urethra going right through the middle.
Thank you. So if it gets inflamed and becomes enlarged, it puts pressure or compression on the urethra. That's why you have difficulty peeing or urinating. And the blood, it can actually cause that urethra to become inflamed and irritated then?
Yeah, exactly.
So those are things you need to kind of look for then. I mean, difficulty urinating, blood in your urine, but there's no pain with it, is there?
It depends on what the problem is. Yeah,
Okay.
If we're talking about prostate cancer, in fact, what's remarkable about the modern era is most men with prostate cancer are diagnosed without symptoms. They're diagnosed by blood tests or maybe a physical exam finding. But actually in my practice, it's rare that someone sees me with a symptom and that symptom is the first time they're found to have prostate cancer.
Well, is it fair to say that if you have symptoms like pain or discomfort, the prostate cancer is probably advanced? I mean, this is one of these cancers that it's so important to get early detection?
Yeah, absolutely. I mean, exactly. If the symptoms that someone is experiencing, like blood in the urine or obstruction, is due to prostate cancer, unfortunately, that probably means it's further along, which is less fortunate than if it got picked up, let's say, much earlier in the process.
It is fair to say, again, just from a medical standpoint, the blood test that they're doing now, what is that called again? It's something with an 8 or something, isn't it?
There's the most common test is called PSA, which stands for prostate-specific antigen, and that's what I think most people are aware of. But there are other tests out there.
The PSA test is pretty accurate. I mean, most family physicians now, I guess I want our listeners to understand that back in the day, you were probably going to get a digital exam at 50 as a male, right? Today, they're just doing blood tests for the most part, or how do you feel about those two?
Well, as a urologist, I really think both are quite important. So I think a PSA blood test and a physical exam in the appropriate candidate, the appropriate patient, is a very good idea.
That's Dr. Joseph Marquez. We'll have more of our conversation with him coming up next on KOMO.
Dr. Marquez, thank you again for joining us, a urologist at the Polyclinic. I mean, you're doing a great job describing this prostate situation. So I have symptoms or no symptoms, but let's say I go to my doctor and I get picked up on my blood screen that I have potential prostate cancer. What's going to happen then?
Well, then typically you'll get referred to a urologist like myself, and hopefully that urologist is pretty familiar with how to manage a situation like that. Because, one of the issues with the PSA test, for example, is that it's not really telling you if you have cancer or not. It's just telling you if you have a risk for prostate cancer. And a good urologist who's familiar with how to manage PSA and just prostate cancer detection will be able to put that into context for you. How serious is this risk? What's the likelihood this is cancer, and what's the likelihood it's serious cancer? And then what are other things we can do to sort that out?
What are the treatment options? I mean, I know cancer care and cancer research and survival rates have increased significantly. I think back 15 years ago, they talked about these proton bullets, or where they put in there. Now you're doing some neat stuff and some advanced stuff, because you want to preserve the prostate as much as possible and eliminate any post-surgical consequences, my understanding is.
Yeah, I mean, as we talked about earlier, the location of the prostate down by the bladder is what puts it in harm's way for things like surgery, radiation, etc. And so a lot of the complications you see from treating prostate cancer come from the fact that the bladder can get involved, the urethra, the sphincter, the rectum, etc. So whatever treatment you can do with the least sort of collateral damage is what the goals are.
You have some techniques, or you're using some robotic assisted devices that are pretty fascinating stuff.
Yeah, so something I'm really excited about is called the Artemis MRI fusion biopsy robot. And that happens in the stage where we're trying to either detect a man with having prostate cancer for the first time, or if he has prostate cancer, but we don't think that those risks we just talked about with surgery and radiation are going to outweigh the risks are outweighing the benefits there. So in those cases, we'll see if men are good candidates for active surveillance, where we're not actually treating this cancer. But to do that safely, we want to know exactly, at least as much as possible, how serious the cancer is. And using this Artemis biopsy robot is one way to do that. We can really look at the prostate. We use an MRI. We take biopsies. We can follow this over time. And so a lot of men these days, especially in my practice, don't necessarily need to suffer the consequences of surgery or radiation.
That's really interesting. I mean, so what you're actually saying is that sometimes, you're weighing the risk of intervention versus the risk of just watching it and protecting the patient.
Yeah, so I like to think of prostate cancer as 5 different types of cancer, and some are serious and some aren't, and the ones that aren't super serious maybe are best followed over time and not treated.
Any advice for men who are notorious for not seeking out health care and following up on annual physicals? I mean, just get it checked. Just go get a PSA, if anything.
Get it checked. Urologists are human. We don't want to hurt anyone. Don't be afraid of pain or anything like that.
Well, you've made me really comfortable. I feel really comfortable talking to you. And if you're like this with your patients, you're a phenomenal urologist. Thank you for joining us.
It's my pleasure. Thanks for having me here.